And we want to continue the conversation this morning surrounding teens and mental health.
Yes, indeed. Joining us with some tips for parents is Megan DeYoung, Director of Business Development with Forest View Hospital. Good morning, Megan.
Good morning. Thanks so much for having me.
So let's just start, with, I guess, for parents that are watching and thinking, okay, it's kind of tough to have these conversations. I'm worried about maybe saying the wrong thing. What's some of your best advice?
Absolutely. The first thing is to notice the change that you're wanting to point out in your teen's behavior. Are they more withdrawn? Is their school performance declining? Are they hanging out with a new group of friends? And utilizing that to become your conversation starter and saying, I've noticed that you're hanging out with a brand new group of friends and that's changed in the last few months. What's changed in your life that's leading to that? And that will hopefully open the doors for parents to be able to continue that conversation with their teen about the stress they may be feeling or the anxiety that is leading to the substance abuse or the potential substance abuse in their life.
Megan, what do you say to those parents who are thinking, okay, we're having the conversation about staying away from drugs and doing different things, but I think sometimes if you keep telling someone to stay away from it, they want to do it even more. What's your response to that?
That's a great question. What we find is that teens are looking for those boundaries. They're looking for honesty and openness. So setting clear expectations in your household is key, saying that in our household, drugs are not acceptable. Alcohol use is not acceptable, but also being willing to be honest about experiences that we may have had in our past. So did we try drugs at a young age and what was the consequences of that? Or experiences that we can speak of from family and friends and utilizing those as examples of why it's important and why we're encouraging our teens to stay away from these substances.
And when do you start having these kinds of conversations? Sometimes you think, no, there's no way, they're too young for that. But especially these days, that's not the reality.
It's not. And we know that 4 out of every 10 teenagers that start drinking before the age of 15 will have an alcohol abuse situation later in life. So it's important to start these conversations early. We see our preteens starting to have these conversations with their adolescent friends in class. So the earlier, the better, just making sure that it's age appropriate as you start those conversations.
And I would imagine that maybe talking to them calmly and not yelling at them helps.
Absolutely. Having a non-judgmental and open space is very, very important. Teenagers know when we're not being honest with them. So the more we can have that honesty and that openness, the better off the conversation will be.